Welcome back to the Sports Medicine Orthopedic Show. I'm Dr. Dennis Cardone, joined by my co-hosts, the Bosco, Dr. Joe Bosco, and the Jazz Man, Dr. Lace Jezraoui. And we're talking sports medicine. We're talking orthopedics. Our phone number, 877-698-3627. That's 877-NYU-DOCS for any of your sports medicine orthopedic questions. And a special guest joining us in studio is Scott Weiss. And Scott is a licensed physical therapist, board-certified athletic trainer in the state of New York, owner and clinical director of Bodhizone, and that's Bodhizone, for human performance and sports physical therapy. Served as member of the medical team for the Beijing, London, and Athens Olympic Games. He's also a registered exercise physiologist, strength and conditioning specialist, advanced personal trainer with over 25 years of experience. He looks like he's about 27 in studio. Scott, thanks so much for joining us. Pleasure to have you.
Guys, it's a pleasure to be here. I'm actually a big fan of the show, so it's nice to actually be in the studio today.
Wow.
You're the guy.
I thought
we should bring him every week. You're the one.
I thought it was only Bosco's mom.
Yeah, we got two people.
Nope, I listen all the time, actually.
That's good.
So you've had a significant Summer Olympic experience. Tell us, Winter Olympics obviously are going on right now. Tell us what you're feeling, and what comes to mind when you're watching the Winter Olympics this year. Anything different? Anything special?
There's always controversies around any Olympic Games, and there's a handful going on at this Olympic Games. Everything from the Circassians not liking that the Sochi Games were on their land, that they were displaced by the Russians. There's the controversy of the LGBT issues with Putin, the killing of stray dogs. So things like that. There's always controversies that surround the games, and those are just a few.
Well, how about like athletic type problems? What do you think about all these injuries to these women? Or the women athletes in the extreme sports?
Concussions are a big thing these days. I think there still needs to be a ton of research done on concussions, evaluating concussions, and truly understanding concussions on a big level. But people are getting injured, and you see that the technical ability rises every games. And as the technical ability rises, there's more chance of injury.
Well, it's kind of interesting. They've been talking about the course, just like you said, for these like X Game downhill events, the snowboarding, skiing, and how they're a little bit more potentially. So women and men are using the same course, and it appears, in the writing, that there's something about it that's maybe a little more injury-provoking for women, or maybe just not as accustomed to training on such these types of courses.
I would agree to that, but the one thing that I guess a lot of the athletes realize is that the playing field is even for everybody. They all got to compete on the same field and on the same courses. So, be that as it may, although it might be more intense for some and easier for others, everybody's playing on the same field.
Yeah, but it was interesting because I think, for the skiing anyway, they're allowed 1 hour to inspect the course. And I guess for the women's Super G or Giant Slalom, they didn't have that time for some reason. And like 7 of the 8 women that ran down the course first, failed DNP, did not place. They skied off the course, blew out.
I know.
Because they couldn't check it out. It's kind of crazy.
I know, and that's
they're all like crashing.
The organizing committee, the Sochi organizing committee, I think is having a hard time dealing with the fact that Sochi is not a winter area. People walking around in shorts and tank tops in Sochi. It's a little odd. So, you can actually see the courses through the ice.
Yeah, and then they have like one, I think it was one race a couple of days ago, because I just came back from a place where they were very interested in it. They had the women's downhill or Giant Slalom, and they started up top where it was like snowing and ice, and they skied through the fog, and then by the time they got to the bottom, it was raining. And that's a big deal because these women are going like 80, 70 miles an hour, and if that snow is the least bit uneven, that's what happened to Lindsey Vonn. She was cruising down at 80 miles an hour and hit a slushy patch of snow, and she went from 80 to 40.
Absolutely.
Except her knee didn't go from 80 to 40. That was the problem. It's kind of crazy.
Scott, what advice do you have for all of us over the age of 40? We were talking before the break about recovery and how that becomes a big issue for us over 40s. What advice do you have?
A physiologist that worked for the USOC named Edmund Burke put together the 4 R's.
The philosophist.
He put together the 4 R's, which is really repair, refuel, revitalize, and rehydrate. And when you put all those together, you'll have some good input on how to really recover better. When we talk about repair, we're talking about really getting back all the muscle protein and getting proteins back in your body. And it seems like leucine is something that people are putting a lot of focus on. When you're talking about, refueling, it's carbohydrates. We're thinking about 20 to 25 grams of carbohydrates in your body as soon as you can after exercise. Really important. And then rehydrate. I mean, everybody knows about hydration, how that flushes the body. Really important. And usually somewhere about 24 ounces for every pound, 20 to 24 ounces for every pound lost. And of course, to revitalize, we talk about all the vitamins and minerals, selenium, zinc, the B complex, antioxidants, things like that. Putting the 4 R's together, I think, is a good place to start from a nutrition standpoint, besides all the physical stuff.
The one thing that always seems to bother me, I'm a big believer in supplements, but there is a lot of data out there to suggest that supplements may actually not be good for us. What's your feeling on it in terms of recovery and some actual data? I mean, the concept being, I had a patient in the office who was a scientist and said the use of supplements, other than a basic general vitamin, can sometimes be damaging because it stunts your body's ability to extract these nutrients from your diet.
I understand what you're saying, and I think people take it to such a level here in America. They think a lot is better. Yeah. But by taking a multivitamin and supplementing on a minor level, I think is fine. But here, people just overdo it. And no matter what, our Olympians are taking vitamins. They're taking minimal supplements, but they are not overdoing it to stunt anything. So from that point of view, I would see what you're saying, but some of the higher-level athletes are aware of that and really keep it at a baseline.
So certainly not good evidence for supplementing, right?
Right.
I mean, exactly.
It's always a challenge.
And maybe some negative, and like you said, maybe even some actually negative about using supplements.
Right. But one of the things is vitamin D, right? We're all sort of vitamin D deficient. I don't understand. The data supports the use of vitamin D supplementation, particularly with athletes, because of the injury levels in those athletes being vitamin D deficient. But, a lot of the issues are they should be getting it from their diet. But it's hard because they're usually either cutting weight or trying to maintain a weight, and it may be difficult to get it in their diet. So.
Right.
We're supposed to get it from sun.
20 minutes of sun.
But the problem is now, there's no such thing as a healthy tan, so we encourage our athletes when they go outside or anyone to lather up in sunscreen, and it prevents you from getting skin cancer, but also prevents you from absorbing vitamin D. Or that's not true. It prevents you from absorbing UV rays, which breaks down and creates vitamin D.
Right.
So that's the big issue. But I think like 4 years ago, you probably know this, the Detroit Red Wings, they tested in the preseason and found a lot of them were vitamin D deficient because they don't go out in the sun and they're very light-skinned people. So gave them vitamin D supplements and they won the Stanley Cup. So people say, well, that's why they won because they got all chucked up on vitamin D. But I'm not quite sure.
Yeah, I mean,
that's
there's
true.
been some controversy about vitamin D supplementation, right? I mean, New England Journal several years ago had all the benefits of vitamin D. And now more recently, maybe not as important. Certainly it's important. And there was a recent study in our sports medicine journal about rotator cuff and healing and vitamin D levels. So anyway, let's go to Florida. Greg in Florida. Hey, Greg.
Hi. I had a question about HIIT or high-intensity training. There's been some research I've seen from like McMaster's University, I think from Birmingham in England, and on this high-intensity training where you do a stationary bike, intense exercise, and you only have to do like 6 minutes a week or something like that. What is your feeling about high-intensity training?
The 7-minute workout.
Well, I think
or the 6-minute workout.
Sir?
Everybody's trying to do things in a shorter amount of time. I do like high-intensity training. I think intensity is really the key factor in training. But I don't know about just doing 6 minutes a day. I don't think that really will add up to a really good, fit exercise, thorough exercise program. So yes, there's a variable in the equation for high-intensity training, and I know the body responds best to, the muscles respond best to, intensity. But I wouldn't push it that far, and it would not be the only thing I do.
Okay. Well, thanks.
Sure. But certainly better than nothing.
Absolutely.
But you want to add more to it.
Absolutely. And when I mean add more to it, you need to have an aerobic program, a good flexibility program. A lot of our athletes right now are taking part in meditation, which really seems to be a very critical key point when they're at the games. Because when you're at the games, everybody's the best in the world. and just the people that could kind of push some of the stress away. I've been finding that a lot of sports psychology and meditation seems to be optimal.
So you just need that little edge.
True. And that's what I find is pretty paramount in every games. And when people are right up to perform for that gold medal, the people that just have that relaxed state and know how to get into their zone seem to really know how to control themselves and their body.
Let's go to Missouri. Esteban in Missouri. Esteban.
Good morning, gentlemen. How are you today?
All good. How about you?
I'm a member of the Over 40 Club.
Welcome.
Yeah, thank you. I've been in it for 3 years, so I've got some time in. I've always been into lifting, powerlifting, played semi-pro football, martial arts, played every sport there is out there. 2010, I was diagnosed with a lung disease where sarcoidosis, so obviously the cardiovascular is affected. I've gained weight, and due to progression of my medication treatment, has caused density in my bones, specifically in my hips. Now, the VA is speaking of possibly doing hip surgery on me at such a young age. Obviously, you guys know that that's not feasible, but more necessary than feasible. Thing is, now I may not be able to get the surgery because the sarcoidosis in my lungs may prohibit me from going and getting the surgery done. My question to you guys is, worst case scenario, I can't get the surgery in my head, so I have to deal with the pain the rest of my life and deal with my sarcoid. What do you suggest for someone in the 40 Club that I can do therapeutic-wise or any type of health-wise to help me with the weight gain?
To answer that, I would say knowing that your first choice should be aquatic therapy. You know, anytime you're in the water and you're taking pressure off the hips and the joints, it's optimal. You can get a great workout in the water, and I think that should be something that you really focus on. Try to look in the area where you're at. Try to get into the water up to about your neck, which takes about 90% of your body weight off. It will reduce the stress on your joints and really produce a great workout.
You know, and people often, they're not comfortable in the pool, but it's a great point. I mean, you could walk, you could run in the pool. You don't have to swim, right? I mean, you could just do anything in the pool.
Yeah, you stay in the shallow end, and there's being a martial artist and a martial artist myself, I have 2 black belts in different martial arts, and doing aquatic therapy and all your techniques underwater will get you a great aerobic workout, and again, taking the pressure off your joints. Stick with the aquatic therapy is my input.
Awesome. Outstanding. You know what? And I like to give myself a little kudos on the common sense area. I never even thought of that. I am so glad I called you guys, because I tell you what, that for some reason has been bogging my mind of what can I do? Because as you're saying in martial arts, you got to do something.
Correct.
I'm biting my nails, and you go and play so much Xbox before you realize I'm not a young man anymore. I don't go online and play these kids online these games. But I never thought of that. I will look at my local health center and see about aquatic therapy. I really appreciate it. Thank you, guys. You really made a difference in my life. Thank you very much.
Yep.
Yeah, I think the other key to understand is just as important as the aquatic therapy is we often focus on exercise, but really, what's this guy's diet? Has he changed his diet? Most of these football players, as they age, they continue to eat the same way as they did when they were in that high intensity sort of workout period. So the concept is he's got to change his diet appropriately too. Probably cut the calories down and really shift potentially from a higher carb diet to a lower carb diet. Incorporate obviously more vegetables. But that will have a significant impact on his weight and ultimately the pressure on his joints. And the key thing is when you talk to these guys, I mean, workout is mostly for fun. I always, something like that. Is he going to lose a tremendous amount of weight just being active in a pool? Probably not, but it's sort of going to mentally lift him up. He's going to feel better about himself, and I think combined with a healthy diet, he'll lose a lot of weight.
Yeah, it's a great start. Good start for him.
Let's go to Maryland. Kay in Maryland. Hi, Kay.
Hello, good morning.
Morning.
I have a question regarding my hip. When I sleep on my left side, and my hip really, really hurts. I tried sleeping on the other side, and that side hurts. I try to lie on my back. Very difficult for me. And my hip is just like a nagging, aching. It goes all the way down my leg. Went to the doctor. They said have bursitis of your hip. The only thing you can do is either take a cortisone shot and relax, not do any exercise. Well, I have 2 flights of stairs in my home that I need to climb, and they say that irritates it, blah, blah, blah. So my question is, do you have any advice of what I can do for that? And on a secondary note, both of my knees, when I sit down, it's like grating against each other. They're cracking, like really bad. So I don't know if that's anything to do with.
Well, hey, Kay, so it's Joe Bosco. So, what you have is something called trochanteric bursitis, and it's really not in your hip, but it's on the side of your hip, really your femur, and it's pretty far away from the hip joint. But people call it hip bursitis. But you should look it up. Trochanteric, trochanteric. Anyway, so and you're the classic person. It hurts when they sleep on their side, and there is a way. And Scott, I'll let Scott answer this. That you can stretch out the tendon that rubs across there to prevent this from happening. But I will tell you that cortisone really works wonders for this, because you're going to have to decrease the pain a little bit so you can do the workout. So it's not, the cortisone doesn't go into the hip joint, so you don't have to worry about any cartilage injury. But I would have the cortisone shot. And Scott, how can after we shoot her up, how can we prevent her from this happening again?
I mean, usually what we do is, once you guys could calm it down and kind of get out of that cycle, the pain cycle, whatever you call it, from that point, positioning is really important for this patient. So I would say making sure when you lay on your side, you keep a pillow in between your legs. That really keeps the hips at an equal or level position. If you do change and move on your back, you should put a pillow underneath your knees. It'll take some tension off of some of those muscles. And of course, if you lay on your stomach, you can put a pillow underneath your stomach. That'll all help support that. But after you have a shot, something like that, you want to keep the iliotibial band really stretched and flexible. We call that doing a crossover stretch, which could be done seated, standing, some good physical therapy, massage, some ultrasound that we use in our field can really help pump some fluid out of that area using some of the mechanical effects. So really just getting a full, thorough evaluation and really letting your physical therapist take a little control of that, I think would be ideal.
Yeah, I mean,
So,
a big part of bursitis now too. When you do, ultimately for the ones who are failing the conservative treatment, you do your MRI. Is oftentimes you see involvement of that gluteus medius, and you see some tearing. So that's also a big part.
Yeah.
Don't even go there.
Yeah.
But a big part of
Strengthening.
physical therapy
and
is strengthening.
repairing that tear really works very well.
The extensors.
Yes.
We're talking about physical
Balance.
therapy,
Right.
the abductors and the hip extensors.
So, okay, you got advice from Scott Weiss.
Wow.
If you take his advice, I think by 2016 in Rio, you'll be doing a triple jump. All right?
Injection and physical therapy, Kay.
Yeah, I actually have had one of the injections some time ago, and it really, like you said, it helped.
Right. So, but if you just get the injection and you don't do the stretching, then it's going to recur.
Well, I do the stretching, and I actually have been going to get a massage, which is quite costly, like 3 times a week, because I'm in such excruciating pain. So now I think I'm going to go back for a round 2 of the shot. I just was hoping that massage would help.
Well, it feels good, but it is expensive because insurance doesn't cover it.
Yeah, right, exactly. But when you're in pain, you'll pay anything.
I hear you. All right, Kay, good luck to you.
Hey,
Thanks.
Yeah, how old are you, Kay?
51.
51. So
Youngster.
it's just a quick answer about the knees with the popping, cracking, grinding that you're describing. So certainly it's possible you may have some early arthritis, early degenerative changes of the knee. When you're seeing your orthopedic surgeon, also just mention about your knees, would be worthwhile to probably get x-rays of the knee to have a better look. And
Okay, because it is both knees, and I do have hemochromatosis, which is I'm in a study for early onset of arthritis with this disease. So
Well, yeah, you can get arthritis. Hemochromatosis is a disease where your body can't really get rid of the red blood cells, right? So your hematocrit's really high, and you get iron deposition in your joints and your liver too. So do you get blood drawn from you once a month? Do you have to take off a pint of blood once a month?
Right. Well, I'm in a study now at NIH for the early onset of arthritis. So my knees, it almost sounds like I have bone rubbing against bone, especially, when you have to go to the bathroom, you have to sit down. So it's like that kind of thing.
Well, good luck with that, Kay.
Kay, have an x-ray. So your orthopedist have an x-ray. Right. We're talking with Scott Weiss. Scott, a licensed physical therapist, board-certified athletic trainer. owner and clinical director of Bodhizone for human performance and sports physical therapy here in New York City. Our phone number, 877-NYU-DOCS. That's 877-698-3627.
So, Scott, one of the things, talking on recovery, something that's become popular has been rolling, or these, these
foam rollers, yeah.
foam rollers, these other rollers
my
with
wife
sort
has
of,
a few of those.
they're ribbed as well.
Yeah.
And the concept being that, yes, they can lead to early recovery, and that either doing them before or after your workout can be quite effective. Can you explain this concept? I have one. It's so boring to do. And the concept of rubbing this thing on my muscle to actually think it will do something major, I don't understand it.
It's self-massage. That's really what it's coming down to. It's self-massage. Again, massage is expensive. Some therapists out there will not do massage. So basically, you're taking it into your own control. So those foam rollers, you could find tender spots, rub them out, flush out your lower body. Putting just the foam rollers aside, what I found that a lot of the Olympians are doing is compression garments. That's going to be a real recovery maker or breaker, better than the foam roller, meaning there's something called the Game Ready or the Normatec, which basically is compression, where athletes after an exercise workout, they will sit with their legs elevated with these compression garments that look like balloons on their legs, just to really get, blood and all the excess byproducts of metabolism back to central circulation. That I find to be a little bit better, using compression garments, sleeves, stuff like that, better than the foam rollers, but it's just massage.
If I get Dennis or Joe to massage me after an event, what's the?
Why? What's right? You don't self-massage.
I don't
It's okay to self-massage. It's all right. Everyone does it, Leif.
So, are you saying that massage leads to better performance?
I think that massage helps flush the body and helps you recover better. Yeah. And if you recover quicker and faster, yes, possibly your performance can be better.
It increases the blood flow, and the blood flow to the muscles gets rid of lactic acid and all the metabolites.
You got it, guys.
Bottom line, let's see evidence for rolling and kinesio tape.
Right.
Kinesio tape.
That's another big one.
Summer Olympics on their back, yeah.
Well, yeah, we tape
Shoulders,
a lot.
Yeah. Good.
Alabama. Deborah in Alabama. Hi, Deborah.
Good morning.
Good morning.
I'm 51 years old, been an avid bicyclist for many, many years, and now I'm having problems with my shoulders trying to roll forward, and I was wondering, what can I do to help keep them straight up?
Scott?
Wow, talk about kinesio tape. We kind of use tape as a biofeedback mechanism. So when you properly tape the shoulder blades with kinesio tape or any type of other athletic tape, you can constantly remind yourself when your shoulders roll forward, the tape will get tight. When you feel that tape get tight, it's a reminder to pull the shoulders back. So for anything, I think kinesio tape is good really as a biofeedback mechanism for the body. So if you have a good physical therapist or an athletic trainer, have them do some kinesio taping pretty much horizontally across your back, and it'll give you some good biofeedback to make sure that you remind yourself to pull those shoulders back, whether in the seated position or standing.
But beyond kinesio tape, it's certainly common, and I'm going to pick on women more than men. As they age, and especially thin women, you start to see their shoulders come forward. They get what we call those protracted shoulders, and we're all much stronger in our chest than we are in our back. So a big component is certainly strengthening of the upper back.
True. And besides strengthening, I think everyone thinks about, you got to strengthen first. My shoulders are rolled forward, I got to strengthen my back. But if you don't have the flexibility in the anterior thorax and you're not stretching your chest, you're not going to have the proper path to strengthen the muscles of your back. So don't forget about the balance, what we always talk about, stretching the front and strengthening the back. Absolutely, Doc.
Deborah, thanks for your call. Let's go to Pittsburgh. Jill in Pittsburgh. Hi, Jill.
Hi. I have a question about what stretches I should do to eliminate this sharp pain, and it's constant in the middle of my gluteus maximus. It's the only way I can get relief is I ask my son to put his elbow on my butt cheek and push real hard and roll it around. I run, I bike, I swim, I do triathlon. So I just wanted to know maybe what muscles are tight and what I should stretch to try to eliminate it. It's a nagging, even while I sit, it hurts.
It sounds to me, and I think the docs would agree, that you might have something called piriformis syndrome going on there. And instead of your son putting his elbow, a lot of the athletes will take a golf ball, a lacrosse ball, and you can kind of do that on your own. But we do a stretch called the figure 4. And you could look that up. I'm sure you can Google the figure 4 stretch. It really hits that muscle tremendously, and you can kind of play with that in multiple angles. But really start exploring piriformis syndrome, the figure 4 stretch, and of course muscle balance is important. But go ahead, look that figure 4 stretch up.
Okay. Okay, great. Thanks a lot then.
Yeah, good luck, Jill.
Thanks for your call, Jill. Let's Dave from Massachusetts, been holding on for a while. Hello, Dave.
Hey, good morning.
Morning.
Had a question about Dupuytren's contracture.
Sure.
So this is a gift that my father gave me, I guess,
Right.
10 years ago.
Are you Scottish or English background? Or
Nordic.
Nordic?
Polish.
Polish. Well, are you sure there's not any Viking in you somewhere along the line? You never know. But anyway, it's more common in people like that, right? Go ahead.
Okay, I'll look. So my question is, after 10 years, it's beginning to limit my ability to move my foot and my hand. And I wonder what I could do to improve this.
So you have it in your foot too?
Yes.
Yeah. So you have like the there's a syndrome. I can't remember it, but foot and the hand. So you know what? Therapy, from what I understand, is not really helpful for it because this is a band of really tight scar tissue and fibroblasts and elastofibroblasts, I think they call it. Anyway, you just can't stretch those things out as much as you'd like to. So really, for the hand, anyway, once it gets to a certain point, you need to have it excised. The excision works pretty well, but and then you do therapy afterwards. But I don't know, Scott, what do you recommend?
I mean, pretty much you hit it on the head. Usually I'll refer that right to you guys first. Some people will do a release or something to kind of release that contracture, and then we try to maintain it in physical therapy.
Yeah, and
Dave, it's
Dave,
really hard.
The
It's
other
really
thing
hard
you
to
could,
do therapy on that, and people actually function pretty well with those contractures. And is it mostly in your little finger?
It started on my left foot 10 years ago, and about 5 years ago, it went to my right hand.
Yeah.
And it's beginning to limit the ability to stretch the hand.
Yeah.
But I can still play squash and I can play golf, and it doesn't,
Well, that's the key because it doesn't really affect your functional ability with the hand, even if the fingers get contracted. Once they get to a certain point, it does. But and then when it gets at a point, you can have the surgery, or they can inject stuff in there now too. I'm sorry, Dennis. You were saying
that's
something?
exactly what I was going to say. There's if you talk to your hand surgeon, there's a enzyme that breaks up the contracture that they do as an office procedure, and it's been pretty successful. So that's something to also talk to them about as an injection to treat this.
Okay. Well, thank you very much for your time.
You're welcome.
All right, Dave, thanks for your call. We're going to take a break, and when we come back, we'll continue to take your orthopedic and sports medicine phone calls. Our phone number, 877-698-3627. That's 877-NYU-DOCS. And continuing to join us in the studio will be Scott Weiss, a physical therapist, and we'll be right back.
This is Dr. Radio.